afternoon, everybody. I would like to extend a very warm welcome to all of you from our part of the world, which is known for its rich culture and diversity. Many thanks to the organizers of the event for inviting me to the session. Although I am a cartilage pathologist chiefly working in the field of cartilage histology and the chondroprogenitors, I will be talking on a literature review covering an overview of the sources and application of the mesenchymal stem cells, which has been discussed, part of it very well by Dr. Robert in his keynote lecture. So the cells were first isolated from bone marrow by Fredenstein in 1968. These cells are specific type of cell capable of evolving into many different types of specialized cells in the body. The reason for the recent interest and development of these cells is because of an increase in the understanding of how the diseases occur, to generate healthy cells to replace cells affected by the diseases, that is the field of regenerative medicine, and for the testing of newer drugs for their safety and effectiveness. So, as we know, the stem cells, they range from pluripotent stem cells of the zygote to multipotent stem cells in the adults. The more developed the stem cells become, the more they are committed to their lineage, along with a lower potential to give rise to the various kinds of cells. The stem cells, or the mesenchymal stem cells, they are multipotent stromal cells which can differentiate into a variety of cell types. So the ISCT, they define the criteria of defining the mesenchymal stem cell to get a standardized collection of the mesenchymal stem cells. So they defined it the criteria based on positive and negative markers, based on the marker expression, the culture type, and the ability of differentiation to standardize the MSCs. The society was established in 1992, and it comprises of the various clinicians, regulators, researchers, technologists, and industry partners with a shared mission to translate cell gene therapy into a safe and effective therapy to improve patient life. The NSCs differentiate into the various adult cell types on when conditioned with the various growth factors. The sources can be nearly all the tissues located, and they are mostly located in the perivascular tissues. They are found in the adults, the neonates, the embryonic cells, and the fetal cells, which again has been discussed very extensively by Dr. Robert. So I will not go into the details anymore now. The adult mesenchymal stem cells can be obtained from any of the adult tissues, namely the bone marrow, the peripheral blood, adipose tissue, skin, synovial membrane, and tooth root, and many more. So, but the majority of them till now have been successfully harvested from the bone marrow. In addition, the fetal and neonatal cells, these are the birth-related tissues, including the placenta, amnion, and the umbilical cord along with the cord blood. These cells have a significant advantage of a ready availability, thus avoiding an invasive procedure and the ethical issues, in addition to the other advantages that we discussed with Dr. Robert just enlightened us with. The mesenchymal stem cells demonstrate three important biological characteristics that qualify them for use in cellular therapy, namely the potential of differentiation, the secretion of trophic factors, and immunoregulatory properties, which enable them to unique therapeutic potentials adjustable to each of the disease targets. So, for example, immunomodulation, engraftment, angiogenesis, wound healing, anti-apoptosis, and chemotherapy are some of the properties which are being used for the treatment of various diseases. Two outstanding features of the mesenchymal stem cells are relevant to immunity, that is immunosuppression and immunoprivilege. So immunosuppression is that describes the fact that the MSCs are able to suppress several functions exerted by various immunocytes, such as the T cell, B cells, and natural killer cells. And this in turn affects the cell proliferation, production of soluble factors, and the cellular cytotoxicity. Immunoprivilege, on the other hand, that means that the MSC themselves are protected from the immunological defense mechanism of the host. So the effective components of MSC treatment is the cell-to-cell contact, in addition to the secretion of tropic or soluble factors. This again has been discussed in detail in the keynote lecture. So the soluble factors, these can be secreted in the tissues or into the culture conditioned medium of the mesenchymal stem cells, which have a cocktail of growth factors, cytokines, chemokines, and enzymes, and forming the secretome. So what is the MSC secretome? MSC secretome acts through paracrine effectors, targeting a variety of cells such as the immune cells and the injured tissue cells. And these secretomes, or the substances which are secreted by the mesenchymal stem cells, or the effectors which are secreted by the stem cells, they can be loaded on the extracellular vesicles for long-term effects. The MSCs have been implicated as a therapeutic modality in a vast majority of disorders on account of the regenerative potential and the anti-inflammatory properties. So to start with the disease applications in the researches in the use of MSCs in gastrointestinal tract, they are particularly used in the inflammatory bowel disease, type 2 diabetes with islet cell dysfunction, and a myriad of liver disorders, which has been so well explained by Dr. Rupert. That is the metabolic liver disease, the inborn error of metabolism, end-stage liver disease. So all these have been studied. And the MSCs particularly seem to play a very important role in controlling and reversing these disease conditions. Another important spectrum is the cardiac diseases. They have been worked, the MSCs have been shown to play a role in aortic aneurysms, myocardial infarction, and coronary ischemia. So in myocardial infarction, the mechanism of action could be these MSCs are implanted onto the damaged myocardium, and these, along with the secretomes of the substance which is secreted by the cells, they help in immunomodulation, improving the electrical conductivity, angiogenesis, and a differentiation of these cells into the myocytes, resulting in a regenerated cardiac tissue. There are various advances and trials which are used for the cardiac disorders, and that comprises of the stem cell derived exosomes, which are used, particularly being studied for improving angiogenesis, proliferation of the cardiomyocytes, anti-cardiac remodeling, and the anti-apoptotic functions. The other important field is the immunological disorders, namely the systemic scleroderma, cytokine storm in COVID-19, critical illness ischemia, and Sjogren's syndrome, and SLE, and many other disorders. So they are seen to help in these disorders by immunomodulation of the inflammatory cells, along with the property of being immunotolerant or immunoprivileged. So these cells, for example, they help in decreasing the activation and proliferation with a decrease in the inflammatory cytokines, along with an increase in the anti-inflammatory cytokines. And coming to the neurological diseases, these are the diseases like amyotrophic lateral sclerosis, spinal cord injuries, cerebral palsies, gliomas, and Parkinson's disease. As many of these diseases are lacking a definitive cure, and MSC promises a future treatment for these diseases. In the neurodegenerative diseases, the MSCs are particularly shown to help by increasing the neuronal survival in regeneration, along with reducing the inflammation and causing an increase in the survival of the existing neurons. A very important role of MSCs is seen in the treatment of osteoarthritis because of the various anti-inflammatory and anti-apoptotic functions. So, osteoarthritis is a disease comprising of an inflammation of the synovial membrane and a degeneration of the cartilage. And the MSCs, when injected into the joint, they cause an increase in the cartilage regeneration along with a reduction in the inflammation of the joints and a decrease in the osteophyte formation. Now, comparing the role of MSC in the osteoarthritis and related disorder, that is rheumatoid arthritis, wherein the primary pathology is the synovial inflammation. So the MSCs have, in rheumatoid, they are injected systematically. In osteoarthritis, they are injected into the joint and have a proven efficacy in osteoarthritis in pain reduction with a partial recovery of the injured cartilage, and in rheumatoid arthritis, it has a proven efficacy with immunomodulation and decreasing the pain associated with the inflammation. The MSCs also help in cartilage repair. They help in the articular cartilage regeneration. They act by various effectors like immunomodulation, differentiation and secretion of the extracellular matrix, and helping in the repair by the endogenous cartilage cells. One of the success stories in the advances of cell therapy during the past decade is the use of these autologous chondrocytes for the treatment of cartilage disorders. So the cartilage cells from the damaged cartilage in the joint is harvested, it is cultured, it is implanted on the scaffold and reimplanted back into the joint to give the formation of the hyaline type of cartilage, which is indigenous or native to the joint and has shown positive results over the years. Stem cells are also shown to help in the healing of chronic wounds by differentiation into skin-like cells and also helping in the migration of cells at the site of injury by exerting soluble factors and microvesicles which help in the healing of the wounds. The other important field is the field of regenerative medicine. With the MSCs, there are ongoing researches with gene therapy on tissue engineering and regeneration of the bone, dysphonia, even the regeneration of the vocal cords. So there are many other fields which are prospective for the cure in regenerative medicine. Now, MSC signaling in cancer progression, that is recognized as an important field wherein the MSCs, there is homing of the tumor locations. They go into the tumor locations and they also promote or inhibit the cancer cell proliferation, they inhibit angiogenesis and also inhibit metastasis. What is important is that the native mesenchymal stem cells may be hired by the tumor and then they can be educated to cause an increase in the tumor growth and metastasis. So hence, we have the importance of genetically engineered MSCs which can do the function of tumor elimination and eliminate and also inhibit angiogenesis and metastasis of these cells. An important challenge to the present world is the pandemics, which present with rapid mutation and limited treatment options, and which has to be handled urgently as it affects the masses. So the MSCs in pandemics is seen to act by the release of various factors like keratinocyte growth factors, by facilitating phagocytosis and impairment of proliferation and differentiation of the cells, along with the enhancement of the restoration of capillary barriers, bacterial growth, and restoring the alveolar ATP, thereby helping reversing the symptoms of the damage which is caused by these various viruses. The proposed mechanism for the MSC action in patients with severe COVID-19, that is very interesting, as the COVID-19 particularly, it presents with an inflammation by the mononuclear cells, which tend to release cytokines, causing a cytokine storm with the associated formation of hyaline membranes and a diffuse alveolar damage. So the MSC therapy is proposed to reduce the inflammation. It causes an immunomodulation of the cells along with the tissue repair and differentiation, reducing the damage and saving the patient's life. Graft versus host disease is a complication following allogeneic tissue transplant, wherein the immune cells from the donor attack the healthy recipient tissues. GVHD presents both prophylactic and therapeutic challenges, and the overall survival is poor. Mesenchymal stem cells show a considerable promise in the treatment of GVHD because of their potential immunomodulatory effects. There are numerous clinical trials for the use of exosome therapies, and the MSC exosome offer a future treatment potential for a variety of diseases, and that again has been so well discussed in the treatment for liver disorders in the keynote lecture. The MSC exosomes have also been used in genetic engineering in cancer therapy, and their four different methods have been developed for cancer therapy. That is, the natural exosomes from some of the immune cells, they suppress the cancer cells. Then we have the inhibition of cancer cell-derived exosomes by the MSCs. We have the exosome acting as gene carriers, and the exosomes carrying the chemotherapeutic drugs specifically to the tumor tissue. The MSC research has faced certain challenges, as an in vitro and in vitro animal studies support the notion that they are potent cellular therapeutic agents. In the clinical trial, allogenic MSCs have been consistently shown to be safe, but have not been able to replicate the large effect sizes predicted from the preclinical research and have failed to meet the efficacy endpoints. The ongoing trials are still in the early phases, and we have a long way to go. The challenges in the technology transfer is a substantial failure in many of the early or late stage clinical trials, which could be due to poor quality control of these cells, or it could be inconsistent characteristics of the MSCs in terms of immunocompatibility, stability, differentiation, and migratory capacity. Coming to the heterogeneity that can occur at various levels, like for example, the cells collected from the donors, which are they can be heterogeneous cells. Then the sources, tissue sources could be heterogeneous. The isolation techniques could also result in getting heterogeneous collection of MSCs, and the culture and preservation conditions. Next, coming to the host factors in the technology transfer, they are the application of the MSCs, immune compatibility of the host, and the host microenvironment. So the application is can be a variation in the migratory capacities of the various stem cells, varying routes of administration, and the different cell carrier materials which are used to transfer the MSCs. There can be a variation in the immune compatibility between the donor and the recipients, leading to a variation in the MSC response. And there can be a variation in the host microenvironment in terms of hypoxia, inflammation, and the extracellular matrix, which changes the distinct function of the MSCs. So we have the advances and perspectives to overcome these challenges, and that includes genetic modifications, priming of the mesenchymal stem cells, biomaterial strategies, and the utilization of the MSC secretome as a drug delivery platform. So priming the MSCs, that is the preconditioning the MSCs to boost the particular function which is required. For example, priming the MSCs for aerobic respiration, that can form the cells have a metabolic reprogramming, decreasing the aerobic respiration and increasing glycolysis, and helping in the anti-inflammatory function in the host. The MSC secretome can be used as a drug delivery platform for treatment. It has shown to have a superior therapeutic capacity for autoimmune diseases and neurodegenerative disorders compared with the parenteral MSCs. They have the MSCs have also been genetically engineered to produce trophic cytokines or other beneficial gene products in numerous preclinical models. And lastly, the other is the biomaterial strategies to maintain more homogeneous mesenchymal stem cells. They help in the adherence and survival of the mesenchymal stem cells, as well as preserving the functional components secreted by the MSCs, thus elongating the effective durations of clinical treatment. They are delivered to the graft site using extracellular matrix scaffolds made up of synthetic polymers, which have revolutionized the advent of these extracellular matrix, and that avoids a foreign body post-reaction. Another major advancement is the use of AI in MSC treatment, where a specific algorithm can be used to reform the molecules, and then that can be formed on the robotic platforms. So the take-home messages from today's talk is that a substantial challenges remain to be overcome in spite of the tremendous advancements over the past decade on the MSC therapy. The main challenges include the immunocompatibility, stability, heterogeneity, differentiation, and the migratory capacity. A detailed mechanism of the MSC immunomodulatory effects is still elusive and lacks substantial evidence. The MSCs are promising and to be proved as effective treatment options for a variety of devastating conditions over the coming years. So I thank you all for listening to the presentation.